Hello everyone, and welcome to this exciting journey into the fascinating world of the knee joint. The knee is truly remarkable, isn't it? It helps us walk, run, jump, and dance. It's strong enough to support our weight, yet flexible enough to allow a wide range of movements. In this exploration, we'll unravel the secrets of the knee joint, understanding its intricate design and how it works to keep us moving. Whether you're a student, an athlete, or simply curious about the human body, get ready to be amazed by the wonders of the knee. Let's start by understanding what kind of joint the knee is. The knee is classified as a hinge joint. Think of a door hinge. It allows the door to open and close in a single plane. Similarly, the knee joint primarily allows our leg to bend, which is called flexion, and straighten, which we call extension. But that's not all. While the main movements are flexion and extension, the knee also allows for a bit of rotation. This means we can slightly twist our leg inwards and outwards when our knee is bent. This added flexibility makes our movement smoother and more coordinated. Now let's zoom in and take a closer look at the key players that form the knee joint. The two main bones involved are the thigh bone or femur and the shin bone known as the tibia. These bones meet at the knee joint to form what we call the tibiofemoral joint. But there's another important bone involved, the kneecap, also known as the patella. The patella sits in front of the tibiofemoral joint, forming the patellofemoral joint. All these bony surfaces are covered with a smooth, slippery tissue called cartilage, which helps the bones glide over each other with minimal friction. Don't let its size fool you. The patella plays a crucial role. Imagine a pulley system. That's what the patella does for our knee. When the muscles at the front of our thigh contract, they pull on a strong tendon that connects to the patella. The patella, in turn, pulls on the shin bone, effectively straightening the leg. This pulley-like action increases the leverage and power of our thigh muscles, making it easier to extend our knee, especially when we're pushing against resistance, like climbing stairs or kicking a ball. Section 5. Blood and nerves of the knee. Like all parts of our body, the knee joint needs a constant supply of blood to deliver oxygen and nutrients and, remove waste products. This vital task is carried out by a network of arteries and veins that surround the joint. The main suppliers are branches from the femoral and popliteal arteries, which branch off into smaller vessels, ensuring every part of the knee receives nourishment. And of course, no joint can function without instructions from the brain. Nerves like the femoral, tibial, and common fibular nerves crisscross the knee joint. These nerves carry messages to and from the brain, telling the muscles when to contract and relax, and providing us with feedback about the position and movement of our knee. Section 6. Menisci, the knee's shock absorbers. Now let's talk about two very important structures called menisci. We have two menisci in each knee, one on the inner side, the medial meniscus, and one on the outer side, the lateral meniscus. They're like tough, rubbery cushions that sit between the femur and tibia. Imagine them as C-shaped discs with their outer edges thicker than their inner edges. They're attached to the tibia and move with the bone as the knee bends and straightens. The menisci are crucial for shock absorption, distributing our body weight evenly across the knee joint and protecting the cartilage from excessive wear and tear. Section 7. Bursae, little cushions for a smooth ride. Throughout our body, wherever tendons, muscles, or skin glide over bones, we find small, fluid-filled sacs called bursae. The knee joint has quite a few of them. These bursae act like miniature cushions, reducing friction and allowing for smooth, pain-free movement. For example, we have the prepatellar bursa located right in front of the patella, allowing the skin to move freely over the kneecap. Another important one is the infrapatellar bursa, which sits below the patella, reducing friction between the patellar tendon and the shin bone. Ligaments are like strong ropes made of tough, fibrous tissue that connect bones to each other, providing stability and controlling the knee's range of motion. The knee joint has 4 major ligaments, each with a specific role to play. First, we have the collateral ligaments, the medial collateral ligament, or MCL, on the inner side and the lateral collateral ligament, or LCL, on the outer side. These ligaments prevent the knee from buckling sideways. Then we have the cruciate ligaments, the anterior cruciate ligament, or ACL, and the posterior cruciate ligament, or PCL, which cross each other inside the knee joint. These ligaments control the back and forth motion of the knee, preventing the tibia from sliding too far forward or backward in relation to the femur. As we learned earlier, the knee joint primarily allows for flexion, which is bending, and extension, which is straightening, of the leg. These movements are essential for activities like walking, running, squatting, and kicking. But remember, the knee also allows for a limited degree of medial and lateral rotation, meaning we can twist our legs slightly inwards and outwards when the knee is bent. These rotations are controlled by specific muscles in our thigh and hip. For example, the hamstring muscles at the back of the thigh are responsible for bending the knee, while the quadriceps muscles at the front of the thigh are responsible for straightening the knee. Unfortunately, the knee joint, being so complex and constantly subjected to stress, is prone to injuries. Some common knee injuries include collateral ligament injuries, which often occur from a direct blow to the side of the knee, stretching or tearing the MCL or LCL, cruciate ligament injuries, where sudden twisting movements, often during sports, can cause tears to the ACL or PCL, bursitis, when overuse or repetitive movements can irritate and inflame the bursae, leading to pain and swelling, and the so-called unhappy triad, which refers to a combined injury of the ACL, MCL, and medial meniscus, often occurring from a single forceful impact. These injuries can be painful and debilitating, often requiring rest, physiotherapy, or even surgery in some cases. However, with proper care and rehabilitation, most people can recover well and regain full function of their knee. Congratulations on completing this incredible journey into the world of the knee joint. We've covered a lot of ground, from the basic structure and function to the intricate details of ligaments, menisci, and bursae. But this is just the beginning. The human body is a fascinating and complex machine, and every joint, every muscle, every nerve has its own story to tell. So keep exploring, keep asking questions, and never stop being amazed by the wonders of your own body.